Hey, I'm Dr. Kennedy over at Highland Park Animal Hospital, and I'm here today to talk about feline blood work and lab work. My assistant Joel is going to ask some questions, and we're going to address any concerns and kind of run through all of the feline lab work that we can do here.
Dr. Kennedy, what is lab work for a cat and how is it done?
Yeah, and most common preventative lab work would be annual blood work for a cat. And this is maybe assuming to be a healthy cat that we're looking for those baseline lab values and looking for, early subclinical disease. Most common would be like a senior panel, which includes a CBC chemistry, urine analysis, and a T4. Big things we're looking for in cats. Of course, if they have any specific issues, we might be looking at specific lab values, but kidney disease, thyroid disease, endocrine disease. These are all things that we're going to be looking for in this blood work, and it is better to catch it early on our annual blood work than to wait till they are showing signs.
How does a baseline lab test impact the health and well-being of your cat?
Yeah, so big things would be, getting that baseline over consecutive years really helps us build a database for your pet and what is their normal. And then when we see deviations from that, even maybe within the normal reference range, we know this is abnormal for your cat. Kidney disease is a perfect example of this, where a normal lab value might be there for years and it might still be normal, but a big jump or a big change could be indicative of disease. So doing that baseline testing, fantastic, great way to catch things early.
What are some reasons that my cat might need lab work done?
Yeah, any sick cat, great place to start. Any vomiting, lethargic, not eating pet, some of those really broad nebulous symptoms, really great idea. Cats, are to some degree still prey animals. They are fantastic at hiding when they are not feeling good. So when they start to show signs, something is pretty serious. So we need to get things addressed. Your veterinarian will take the history, your pet's medical past, the signs that they are showing in the physical exam to really dictate those tests so we do the most effective lab work for your pet. But really, it's a good thing to always have on hand. Make sure we have recent lab work in the file for them.
What are some possible cat health conditions that lab work can help detect?
Most definitely. Yeah, I touched on this a little bit. Big ones we look for: thyroid disease, kidney disease. Lab work's really the only way to detect that until they get to really end stage levels of kidney disease. Um, uh, Endocrine diseases like diabetes, and then some infectious agents as well can be seen in the CBC, other parts of the lab work. Those are kind of the big ones. Liver dysfunction as well. We're looking at organ function. We're looking at blood electrolytes and other metabolites. Looking at urine, we're looking at some hormonal testing. So very broad net, and that can be a great screening tool for your pet.
Is blood work alone enough to ensure a proper diagnosis of cat illnesses?
Blood work, just like any other diagnostic tool, is merely that. It's a tool in our tool belt. So we need to direct these tests with purpose and intention. So no, not all conditions can be caught on lab work. It's an important screening tool for a healthy cat, but there might be additional testing that needs to be done, such as imaging, specific infectious disease testing, physical examination findings. So no, it is not a one-stop shop for pet health, but it is a great screening tool and a way to pick up on subclinical disease.
Why is early detection and diagnosis of cat illnesses using lab work so important?
Yeah, I touched on this a little bit, but cats are tremendous at hiding disease. They can act normal until the very end. So when we are looking at this lab work, we want to catch things early before they are so sick that they are showing those signs. This varies cat to cat, but generally they are very stoic in nature and don't want to tell us that they don't feel good. So catching it early on blood work is a way to get a better prognosis most of the time.
Wonderful. Thank you so much for your time today, Dr. Kennedy.
Of course. And if you have any questions or concerns about your feline, please give us a call, and we can schedule a consultation and maybe even consider doing your own lab work.